Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, when it comes to numbers, we all know that stepping on the scale can be one indicator of our fitness level, how much you weigh. But weight isn't the only measure that can be used to gauge your fitness.
To get the whole picture on your health, knowing your cardiovascular fitness level, body composition, and even measures of balance and flexibility can help direct you to an exercise program that will improve your health, wellness, and even your overall quality of life. Here to discuss the importance of knowing all your numbers is Dan Gaze, exercise specialist at the Mayo Clinic Healthy Living Program. Welcome back to the program, Dan. It's good to see you again.
Good to be back. Thank you.
Dan Gaze, let's talk numbers. Good to have you on the program. So when it comes to health and fitness, what numbers do we really need and want to know other than weight?
The biggest one that we need to know is our cardiovascular fitness. There was a landmark study, I believe in 1999, that listed things that predicted all-cause mortality or whether or not you're going to die earlier than you should. Cardiovascular fitness was the number one predictor. So if you were in better shape cardiovascularly, so if you could do aerobic exercise longer than others in the same age and gender range, you're going to live longer. You'll have a better quality of life. So it's important that people know how to get that tested and what to do with that information.
All right, and how do you get it tested?
Well, here at the Mayo Clinic, we have the Healthy Living Program. That's an area that I work in, and we assess a lot of different physiological variables, one of them being cardiovascular testing, so we use a stress test. We also measure strength using upper and lower body measurements of how much weight we could press with our legs or our upper body. DEXA machine, which is kind of a scary little vessel to get into, but basically you're laying flat and you're getting a little bit of x-ray over the top of your body. It lets us know how healthy your bones are, but also where fat and muscle is distributed in the body. And there's a lot of research that shows, especially in men, if there's more fat in the abdomen, we're going to have higher instances of cardiovascular disease, diabetes, and other things that are going to stick with us throughout our lifespan and ultimately shorten how long we live. The other thing that's important as we age, we lose balance, we lose cognition, and if we can test those things that we do on our regular activities of daily living, so sitting down, getting up, getting out of bed, the things that we take for granted when we're younger, if we can test that and start to give exercises towards improving those skills and those life skills, then we can have a better quality of life as we go on to our 80s and 90s.
Does weight matter at all? Does that number matter at all, or does BMI make a bigger difference?
BMI is really good in large population studies. So when you're looking at 30 or 40,000 people to try to get a gauge of what everyone's level of obesity or leanness is, it works really well. It's a very simple equation.
And tell us what it is.
So it's a ratio of height to weight. And typically we think of 25 as the ideal number, but it varies because I'm 6'4" and I weigh 210 pounds, but I'm obese because of my size and my frame. If you get more specific information, like with a DEXA scan, you can look at muscle mass. That's a better predictor of whether or not you're going to be actually lean.
Your BMI categorizes you as obese? Or are you just using that as an example?
No.
It really does?
It does. And then when I go to the primary care provider, when they do the height and weight, I get a handout on how to maintain healthy weight as part of just an algorithm.
Oh my goodness.
Well, yeah, it's a formula, and it's you can either do it in pounds or kilograms, and then meters or inches, and you divide it out, put your numbers into the formula, and it tells you what your BMI is. Yeah. Yours is probably 21.
I don't know. I don't know.
That's good.
This is a number I need to find out.
Yeah, I mean, it's like having your blood pressure less than 120 over 80. If your BMI is less than 25, that's good.
Okay.
But some of the people that you see on the street, unfortunately, have a BMI of 40 or 45, and what is it? 30 is obese, and 40 is hugely obese.
Morbidly obese, but they've changed the
obese,
categories to be class 1, class 2, and class 3 rather than having just obese and morbidly obese.
All right. It sounds better. Anyway. What about body composition? Does that matter?
It does. We really need to know how much of our body's skeleton is holding on to lean muscle tissue or what is fat, what is abdominal fat, what is visceral fat throughout our body. Those that have more lean muscle tissue tend to burn more calories at rest because they've got a large amount of lean tissue that needs to use calories. So folks that have more lean tissue tend to be leaner. They tend to have better body composition or lower body fat percentages.
When it comes to balance and flexibility that you had mentioned before, continually test that? You get the first time is just a baseline, or you said you then give exercises to try to improve balance and flexibility?
Yeah. So everything we do is a baseline unless we've seen people
Sure.
come back to us before. The nice thing is with balance and flexibility, like a lot of other variables, no matter how old or young you are, you can always improve upon it. We do very simple things like standing on one leg, eyes open, eyes closed, so a very static test of balance. But if you don't do well, you can practice that at home while you brush your teeth or while you do some of the tasks, wash the dishes, things like that. So there are small improvements we can make, but as we improve, we can then improve our exercise program, and we're also decreasing the risk of things like falling, which is a huge risk or a huge interest for folks as they age.
All right, so tonight when you brush your teeth on one leg with your eyes closed, see how it goes.
I'll
Report
try.
back to us, will
I'll
you?
give that a try.
So how long does it take you to do all these tests, and then what do you do with the information? How do you come up with a plan?
So we work in tandem with a physical therapist and then a physician that we have at the Healthy Living Program. It takes about 4 hours. So we can go through all these tests in 4 hours, take the information, and put together a very well-rounded exercise program before they leave. So typically folks come into us at 7 and they're done by 11:30 with an exercise program in hand.
Is this an exercise program that they can pretty much do at home, or do they need to go to some fitness center or athletic center to be able to do what you're going to prescribe?
We let them tell us where they're going to exercise and we build the program around it.
Really?
So in our facility above the Dan Abraham Healthy Living Center, we have a gym that basically mimics anything you could find in a hotel, a corporate gym, commercial gym, or even home gym. So we don't want to give people unrealistic things that they need to come back to Rochester for. We want to give them something they can do, something that's easy to do, and something that they can take with them wherever they go.
So you have alternatives to barbells. For
Exactly.
example, if you suggested to somebody who was getting a little bit older that they do strength training, you could show them some things that they could do at home without weights and barbells.
Without weights, body weight is a great form of, it's the most portable exercise machine we have because we're always with it. But things like exercise bands, things that don't take up a lot of space. Suspension training is a very big thing now because it's portable and you can hook it to a hotel room door, but it's a very humbling exercise because it's your body suspended and you're just pushing against your own resistance. So it's a very cool thing, and a lot of people gravitate towards it. But everything that people want to do, we can help them do, and we can help them do it in the time and the space that they need.
Around the country, we're on a lot of radio stations, so not everybody can come to Rochester to the Healthy Living Program. So first of all, they can go to their area physician and ask for some of these numbers more than just like their blood pressure or their weight. Correct? Is that a good idea that people should do?
They should, and if they're worried about improving their physical fitness or worried about improving their health and they don't think that, for example, BMI matches with their body composition, they can ask or they can find a local fitness facility. And most fitness facilities do these types of testings in one way or another. But also any kind of medical facility like we have here at Mayo Clinic, a research institution, should have access to some of these tests.
We've been talking with exercise specialist Dan Gaze about the importance of knowing your numbers to help you get on the right track to health and wellness. Thanks for joining us, Dan.
Thanks for having me.